This little video intends to give you a little bit of insight into the ins and out of Brazilian butt lift revision surgery. I'm Dr. Aslani. I'm heading Cirumed clinic in Marbella, and our clinic has been mono-specialized in Brazilian butt lift for over 15 years. I'm in surgery 30 years, but 15 years I've dedicated my whole clinical work to body contouring and buttock surgery. I'm going to run you through a few cases. All the photos I'm showing you are patients of mine and have orderly consented. So what is different about the Brazilian butt lift revision surgery, because we tend to see the repetition of some problems, but basically you have an altered anatomy. You don't have the tissue planes that you have in a primary BBL. You often have a lot of fibrosis, scar tissue, especially if a lot of technology like phaser or similar things have been used. I'm not saying that these technologies are bad. In contrast, I'm using similar things too, but you can often say the less experience a surgeon has, he more tends to overuse these technologies. So it is often a much more demanding procedure than a primary BBL. Now, I think probably due to the fact that we have completely specialized in BBL over the last decade, we've seen more or less exponential increases of BBL revision inquiries. Our fresh audits from 2025. In 2025, we've had more than 2/3, 72% of our BBL work has been revisional. That means we have operated on patients who had BBL somewhere else before, with variable degrees of results and modification, correction, or rectification, depending on the case. So we hope we can contribute, I think, a very competitive experience, not only with Brazilian butt lift, but especially with revisional Brazilian butt lift, because that has started to make up a lot of our work. When we started doing this in 2009, 2010, there were not so many people doing it. Now we have an endless array of clinics, and especially franchise clinics and low budget chains who are doing this, so we see more revisional work. I've picked a few cases to show you, and I think this is probably, for my humble opinion, the best example for what makes up about 90% of our revisional work. You see this lady, she had a BBL elsewhere before, and she came with a problem that I observe a lot, which I see in the vast majority of my revisional cases. The lipo didn't go down low enough. There was no waist definition, the waist was too short, and the fat was placed too high. So what we did in this case is we didn't put any more fat, so there's no fat transfer. This is just corrective lipo. We did a waist definition lipo. We brought the fat graft down. We made the waist longer and the buttock shorter. So that's something that is very rewarding to correct and makes up for the majority of our redo cases. You see here an intraoperative example on the table just to show you what we actually do here. And you see that the lipo around the waistline, this lady came with no waist definition, and we kind of did a waist definition lipo, got the buttock shorter and rounder, and that makes up for most of it. More challenging is a case like this. You do see here from the right side especially. This is a case where the previous surgeon obviously tried to suck out something that he considered to be saddlebags. What he actually did, he sucked out the lower pole of the outer buttock. That is much more complicated to correct. We did equalization, corrective grafting here. More complicated situation to rectify, but of course it's something that we also see quite a lot. That's a very interesting case here. This young lady, she had a BBL, and of interest, she had, at least she said, some rib remodeling. We did a CAT scan, a CT scan, and actually found that instead of breaking 6 ribs like we usually do, she just had 1 rib broken, and that a little bit in the wrong place. So we redid the rib remodeling. We did a redo BBL, shaped out the waist. So you see she didn't really have any waist definition liposuction, and that got a very reasonable result. I've picked you this case too because this is something that we see more and more That was a lady with buttock implants put elsewhere, probably I think 20 years ago. She was not completely unhappy with the implants, but she was also not happy the implants were intact. They were completely fine. So what we did, we fat grafted around the implants, and that's a good solution for those who come with old buttock implants, also a relatively frequent revisional scenario. So what we do when we plan a revision, we try to have as close as possible a look at the previous procedure. It's endlessly helpful to have any kind of surgery report if we can. That is not very frequent that people come with a surgery report, but it's great if you have. And then we check, we analyze how can we improve it with the least possible stress for the patient, and trying to make a detailed plan for each situation. So that's really how we proceed in those cases. What is very frequent, especially when people had various BBLs, we work a lot with rib remodeling. That has really been a very powerful addition to our armamentarium, especially for people with 2 or 3 previous BBLs. That helps, to get them a more drastic result and more waist definition if their lipo possibilities are exhausted. Our let's say specialization in this has not been completely voluntarily. I think all surgeons prefer to do primary virgin cases, but how did we come to that? Because we specialized, let's say, for 15 plus years. I'm doing nothing else than BBL. That's my philosophy. If you want to do something at a great Champions League level, then you have to limit yourself to one procedure. You can impossibly offer 20 surgeries at world-class level if you don't focus. So that simply cannot be, and that is something that our experience shows, that this is what our patients do appreciate. So, but if you're considering a revision BBL, again, it's good if we can have previous information about your surgery, as much information as possible. We usually recommend to wait 12 months before doing a secondary BBL. That's sometimes a little bit hard to accept for patients. In really drastic cases, you can theoretically do it after 6 months, but under no given circumstances should you embark on a second BBL before 6 months have passed. So I think what is in the light of BBL is something that an honest and frank surgeon must also mention. Expectation management is challenging in our TikTok and Instagram society. I'm not going to be imprecise about this, but we do also say a fair amount of revision BBLs where people obviously have a really good result, but they've just got an expectation problem because what is in their head overblew the anatomical possibilities. That's another reason for revision. Sometimes we try to clarify that as well as we can. BBL is a wonderful procedure, very high patient satisfaction, very rewarding, but it is also notoriously a procedure where people's expectations overblow a little bit. So if your BBL didn't turn out as hoped, we are very, very optimistic we can help you with this. So let us plan it, let us analyze it. If we can have you before versus after picture and a surgical report best, and then I'm very confident that we can resolve this to your liking. So we look forward to hearing from you and receiving your pictures. With our best regards from Marbella.